which one is better, what is the significance of each exam, and what is the exam study and pattern for the exam. So first of all, we will discuss about PLAB. PLAB is the licensing exam you need to work in UK. If you want to practice medicine in UK, then you need to pass PLAB exam. So it is just like you have licensing exam for each and every country. Just like in Pakistan you have PMDC, in India you have they have their own system, and in Saudi you have SMLE, in Dubai like DHA, in Australia Australian Medical Council. For UK the licensing exam is PLAB exam. To go through this exam, and it has two parts. The one I talked about is about the PLAB 1 exam. Okay, so PLAB 1 is a written exam of 3 hours duration. It basically consists of only one exam, which is of 3 hours duration, and it contains all the MCQ scenario, the basic MCQs from the final year studies like medicine, gynae, surgery, ENT, orthopedic, pediatrics. So it includes generally all the subjects, and total it has 180 score, and for passing I think it's a 118 or 120 score is needed to go through this exam. Then we will talk about PLAB 2 exam. PLAB 2 is a clinical exam which you can give in UK. For this you have to take courses, online courses as well as physical courses. If you have already good clinical practice, then you can go for exam directly without any course. But if your clinical practice is not good, so don't worry that you will not be able to pass exam. You can pass the exam. Nothing is impossible. So you can pass the exam easily by watching the videos on YouTube, on different portals about the PLAB. You can find the videos on Facebook, on Telegram, and also you can go for the courses as well. The live courses are conducted in different countries like in Pakistan, in India, in Bangladesh, in UK. Everywhere they have their own courses. The famous one I heard about is Swami course. And also one more thing I want to mention, that this is a licensing exam and the exam fee is also less. If you want to start practicing in UK with a short time duration, like you want to go immediately to UK, so PLAB exam usually takes 6 months. But nowadays because of COVID it is difficult to secure slot, so it usually takes 1.5 to 2 years to pass the exam and start practicing in UK. But before COVID it was easy to finish PLAB exam, both part 1 and part 2, within 6 months if you are already enough prepared. Okay, and the exam fee for PLAB exam is also less than MRCP, and only 2 exams are needed to get a license. So this is all about PLAB. And for one more thing I want to mention, for PLAB 1 you have exam centers in almost all the countries. So you can give exam either in Saudi, either in Pakistan, either in Dubai, in Bangladesh, in India. Every country has their own centers for PLAB 1 exam. But PLAB 2 has certain venues for the exam. You can check on their website. And for PLAB exam, to book the PLAB exam, you must need to pass OET before PLAB 1 exam. OET is a mandatory, either OET or academic IELTS. So there is a specific score you have to secure before proceeding for PLAB. You cannot book a slot without OET exam or IELTS exam. And after passing the IELTS exam or OET, you have to make an account on the GMC website to register yourself for the PLAB exam. And nowadays you have to secure slot with much difficulty. You have to wait. There are specific dates mentioned on the website. Just keep on looking the website of GMC in UK to see when the slots are available to be booked. Okay, next one, now we will talk about MRCP. MRCP or MRCS or MRCOG. There are 3 different specialties for different field. MRCP is for medicine, MRCS is for surgery, MRCOG is for OB/GYN, and MRCPCH is for pediatrics. So what are they? All of them are the specialty exam. They are just like they are not the basic exam like the PLAB exam. PLAB is licensing, but this is a specialty exam, like you will get diploma in medicine. MRCP is membership of Royal Colleges of Physicians. MRCS is Royal Colleges of Surgeons. Similarly, MRCOG and MRCEM and MRCPCH. Okay, and there is more advanced degree. You will be entering into ST3 directly after passing your MRCP exam. Likewise for MRCEM and MRCOG and MRCPCH and MRCS. Okay, it is not the basic. It will be about the specific field. Like if you are giving MRCP, it is especially in medicine only. It will not contain the other subjects like surgical, like pediatric, like OB/GYN. They are excluded. It is just like the specialty exam. Each specialty has their own exam. Okay, so for MRCP, and here we will be discussing about MRCP only. So MRCP has basically 3 parts. Part 1 and part 2 are written exams, and part 3 is clinical exam. For part 1 and part 2, you can give exam in your home country, and you can take 3 to 6 months for the preparation. Part 1 is basically from the theory. Most of them are scenarios, while part 2 is also theory, clinical scenarios, but they mostly contain the figures, like for ultrasound, like for x-rays, like for ECGs, CT scans. So you have to practice more and more images as well to have a more clinical and strong grip. Okay, and then comes the clinical exam for MRCP, which is also called as PACES. PACES has limited centers in various countries. Pakistan and UAE, UK has the most centers. Besides this, we have centers in Malaysia, in Abu Dhabi, in Dubai, in Oman, in Sudan, in Egypt. They are run in various countries. So it depends upon where you get the location. But nowadays, because of COVID, it is very difficult to secure a slot. For some people, it may take up to 3 years. For some people, up to 5 years. And some people even wait for 7 years to get a slot. So it is a long route. Although it is a specialty exam, you will be serving as registrar after passing MRCP, but it is very difficult to get to secure a slot for PACES exam. And just prepare your mind that you have to wait for some time to secure slot for PACES exam. And PLAB is the shortest route. It is the basic licensing exam, and you can start practicing as GP, general practitioner, in UK. Once you start practicing as general practitioner in UK, you can go for MRCP exam, because if you are working in UK, you have more chances than the normal people to secure a slot, because UK has the most centers for MRCP. So also the fee is more for MRCP part 1, part 2 and the PACES exam as compared to the PLAB, and clinical practice is needed more as compared to the PLAB. As I told you already, that after your MRCP exam, you will be serving as registrar. So this is all about MRCP and PLAB exam. What is their difference, what is their significance, which one you can offer. And one more thing, for PLAB exam you do not need any experience or anything. Just after your MBBS you can proceed with exam. But for MRCP you need 18 months experience with a consultant, which you have to mention before your clinical exam, which is also called as PACES. Okay, I hope this all is clear for you guys. Thank you so much for watching.